So one question I commonly get asked is about, Doctor, I am bleeding in early pregnancy. What could be the cause? It is quite normal to be alarmed if you are bleeding in early pregnancy. However, this does not always mean that you're having a miscarriage. Bleeding in early pregnancy can be due to implantation bleeding. This is when the embryo is attaching to the lining of the womb and you experience what we call spotting, which is little amounts of bleeding. Also, you might have bleeding in early pregnancy due to changes in the cervix. The cervix starts to change cells, and sometimes it is quite common, especially after you've had sexual intercourse, to experience a little bit of spotting or bleeding. Obviously, the third other cause is, are you having a miscarriage? Now, miscarriage is common mostly before 12 weeks of pregnancy and can happen anytime between even 2 weeks to 8 weeks as the most common time periods. Some women actually miscarry while they're having a period, or what they think is a unusual heavy period with clots and lots of flooding, and they think, oh, this is a period, because they didn't even know that they were pregnant in the first place. But this is when they're actually having a miscarriage, which is what the misinterpret as having a period. Now, miscarriage can also happen with other symptoms or signs. You might experience, a bit of tummy pain, or what we know as tummy cramps. And this is when your uterus is contracting. It is trying to push out all the bits, or what should I say, tissue, away from the uterus and out of the womb into the, through the vagina. And this is the body's normal response to when you're having a miscarriage. Now, if you're having a miscarriage, or if you think you're having a miscarriage, what should you do? Well, the first thing to do is call your doctor, because your doctor might want to examine you. We have what we call an open miscarriage. An open miscarriage means this is inevitable. It's going to happen. How do we know that you're having a definite inevitable miscarriage? Now, there are different types of miscarriages. You have what we call an inevitable miscarriage. And an inevitable miscarriage can happen because the cervix is open. So there's nothing that's going to close the cervix. The cervix is already open, which means that the contents of your uterus are coming out regardless. Now, we have another term called a threatened miscarriage. A threatened miscarriage means might happen, might not happen. In this scenario, the cervix is still closed. So it's a case of watch and monitor. You're experiencing cramps, you're having bleeding, it's continuous. Is this going to happen? In a lot of cases, you can go on to have a successful pregnancy. In some other cases, you eventually have a miscarriage, and a doctor will examine your cervix to find out if it's open or closed. If it's open, inevitable miscarriage. If it's closed, a threatened miscarriage. Now, with a missed miscarriage, it doesn't tend to present with fresh bleeding as such. In a lot of cases, this is usually noticed when you go for your routine scan, or you have an early pregnancy scan, and it's noticed that there is no heartbeat or there is no yolk sac. And this means that you could be possibly thinking you're 12 weeks, but you actually had a miscarriage 3 weeks ago, which means that the fetus was 9 weeks old. Eventually later, you might start experiencing some cramping or some, bleeding, and that continues to progress into more significant pain and continuous bleeding. Every woman is different. Some women bleed over days or weeks. Other women can just bleed in one day and that's it. And usually you're given the options. Do you want to watch and monitor at home? Do you want to have it medically, where you're given tablets, go home, come back again, take another course of tablets 48 hours later? Or do you want to have it surgically done? Now, with a miscarriage, if you're thinking, I'm bleeding in early pregnancy, I can't get a doctor, you can also go to the hospital known as the early pregnancy unit. Now, if you're before 6 weeks, usually if they do a scan, they might not see a heartbeat, and this can cause anxiety for you. So it's usually advisable not to do a scan before 6 weeks. So usually, if you're less than 6 weeks, they will do HCG blood tests. Now, the HCG blood test, corresponds to the number of weeks you are. So if you're week 4, you might expect something like, I'll just give a ballpark figure, something like 2,000. And then if the blood test is repeated 48 hours later, it could be 4,000. So you expect the figures to double with a successful pregnancy. However, if the pregnancy is failing at week 4, you might be 2,000, and then repeat it, you're dropping down to 1,800. Now that's not a successful pregnancy. Or you might actually be 600 at week 4. That means that you actually miscarried a few weeks ago because the pregnancy is not advancing. And that's the benefit of doing an HCG blood test, which is done 48 hours apart. If you're obviously over 6 weeks, then they can do a pregnancy ultrasound scan, where basically they look for the yolk sac, they look for the, the heartbeat. And if the heartbeat is showing, then yes, good news that, okay, let's monitor. Obviously, if the heartbeat is not showing, They might again say, look, let's bring you again to check, to confirm, because it could be that maybe we've got the dates wrong. You might not be 6 weeks, you might be 5 weeks, you might be 5.5 weeks. Even a few days can make a difference with the heartbeat not showing. So don't be alarmed, stay calm. You just never know. Now, the other thing to look out for is what we call an ectopic pregnancy. An ectopic pregnancy can also present with bleeding, usually common around 6 to 8 weeks ectopic pregnancy. There can be clues that this could be an ectopic. For example, have you had a previous ectopic pregnancy? Is it an IVF pregnancy? Are you having pain on one particular side? Usually the left lower side of the abdomen is the most common. Another clue could be shoulder tip pain. Some women might experience pain in the tip of the shoulder. That could be a sign of an ectopic. Also, what we call tachycardia is your heart racing so fast. So these are symptoms or signs that this is an emergency. This is something that in usual cases you might need surgery, or there are other medications that they usually give, but usually surgery in most cases. So you need to be going to the hospital straight away. So we're looking at, causes of bleeding early pregnancy. Could it be implantation bleeding? Could it be changes in the cervix? Could it be a miscarriage? Or could it be an ectopic pregnancy? So if you have any of these features that I've described, please make sure you see a doctor.